Dr. Ken Landau. Thanks for watching. Let's talk about vitamin B12. It's a water-soluble vitamin. The term itself refers to a collection of molecules that contain a corrin ring and some cobalt. Now, any of those forms are changed into the active form inside the body. And vitamin B12 is involved in the metabolism of every single cell in the body. It's naturally present in some foods. It's added to other foods. You could take it as a dietary supplement or a prescription. And it's available in several forms. We call them vitamers. There are 4 principal vitamers, some with cyano groups, like cyanide, others with hydroxyl group or methyl group. And all of those are altered inside the body to the active form. The function of B12, well, it's a cofactor in the production, the synthesis of DNA and RNA. It's involved in fatty acid metabolism, amino acid metabolism, neurotransmitters. It's important in the central nervous system, in the production, the synthesis of myelin, the maturation of red blood cells in the bone marrow. Without an adequate amount of vitamin B12, you're going to have an increase in the free radical production, oxidative stress, inflammation, beta amyloid formation. Well, vitamin B12 is pretty important. It actually is responsible, the chemistry of vitamin B12 is responsible for 5 Nobel Prizes. Vitamin B12 is produced in nature by certain bacteria and archaea. Those are organisms like bacteria. They're synthesized in some of the bacteria in your gut flora, but unfortunately, the vitamin B12 that we manufacture in the body, made in the colon, so it's passed out. Unfortunately for us, the vitamin B12 has to be absorbed in the small intestine. So since the production is in the colon, that just doesn't work for us. Well, many animals store vitamin B12 in the liver and in the muscles. Some passes into eggs, into milk. So good sources of vitamin B12 are liver and eggs and milk. But the bioavailability of B12 from eggs, let's say, is less than about 9%, whereas from fish, meat, and fowl, it's probably somewhere in the neighborhood of 40 to 60%. You absorb about 1 to 5 micrograms, 1 to 5 micrograms per day. The US RDA is about 2.4 micrograms per day. That took effect in January of 2020. Up until May of 2016, the RDA was 6 micrograms per day. We store about 1.5 milligrams, that's 1,500 micrograms inside the liver. In women who are pregnant, women who are lactating, need just a smidgen more, but the daily consumption of about 3.5 micrograms more than covers most individuals. The absorption, as I said, is 40 to 60% from fish and meat and fowl, but that's only up to a certain point, because you need something called intrinsic factor, and you only have so much intrinsic factor. After you get to a certain point, then you absorb only about 1, 2, or 3% of the vitamin B12 that you consume. Well, it's not in plant foods, but it is fortified now in some of the breakfast cereals. There's high bioavailability of the kind of B12 that you get in the breakfast cereals. Other fortified foods are available. You have to read the label. The listing for B12 is not required on the label of foods unless the food has been fortified with vitamin B12. You can get it from some nutritional yeast products. You certainly get it from the standard kind of meat, fish, or fowl. Well, vegans, who are the most strict of the vegetarians, they're only going to get somewhere between about 0 to 0.25 micrograms a day. That is, if they don't have any animal products and any fortified foods. So that's not sufficient. Other vegetarians, depending on whether they consume meat or whether they consume dairy or eggs or chicken or sometimes fish, well, they might get some B12, but it might not be adequate. So probably about 40 to 80% of vegetarians or vegans are not going to get sufficient amounts of vitamin B12, so they're advised to consume a supplement. Now, what's the likelihood you're going to be deficient if you're just in the general population, you're eating relatively normally? Well, we define the level of B12 in the bloodstream to be adequate if it's more than about 150 picomoles per liter. Okay? That means that about 4% of people between the ages of 40 and 60 are deficient. They don't even have that much. And about 6% of people over age 60 are deficient. Now, if we look at people who are marginally deficient, and we define that as between about 150 and 225 or 250 picomoles per liter, well, then the marginal deficiency rate is about 15% in people who are less than age 60, and it's probably about 20% or more in people who are over age 60. And in certain countries, for instance in India, about 60% of people are vitamin B12 deficient. Well, the B12 is going to be absorbed through the intestine, but it requires a certain kind of a factor that's made in the stomach. That factor is called intrinsic factor, and you only have a certain amount of intrinsic factor, so you can flood your body with B12 by supplements. But for the most part, the absorption is going to be limited to a very small quantity once you surpass the amount of intrinsic factor that's available. And in spite of the claims, you have sublingual preparations and lozenges of vitamin B12, but they're not different than the standard oral tablets. You have intranasal gel that hasn't really been thoroughly scientifically vetted. We have the intramuscular injections of vitamin B12. That's important if a person is malabsorbing B12 or has severe deficiency in B12, but for the overwhelming majority of individuals, we can simply flood the system with oral B12 and you don't have to get a shot. Well, you hear a lot of people taking those energy enhancers or athletic performance boosters that supposedly have a lot of vitamin B12 and gives you that extra boost. Does it really? Well, yeah, but only if you happen to have a deficiency in vitamin B12. If you have megaloblastic anemia or you're marginally deficient, but for the overwhelming majority of people, it's not going to improve fatigue or weakness. Now, the good news is that you can't get an overabundance of vitamin B12. It doesn't seem to be toxic. The potential for toxicity is extremely small, but you have a significant chance of not getting enough B12, especially in our modern lifestyle, because it seems like so many people are popping those proton pump inhibitors, omeprazole or Prilosec or Prevacid or the AcipHex. All of those drugs are going to interfere with the ability of acid to release B12 from food, so you don't get sufficient amount of absorption. And the same thing holds true for Tagamet and Pepsid and Zantac. All of those are going to slow the amount of acid, and as a result, you're not going to get as much B12 absorption. Another thing, a lot of people are taking metformin. Metformin is a very good pill, certainly if you have diabetes or PCOS. If you have certain other kind of medical conditions, might be appropriate, but you have to be careful because the metformin might interfere with the absorption of the B12 through the small intestine because it interferes with the B12 intrinsic factor complexes, so that it's estimated that if you take the metformin for a while, you have about a 7% chance of being B12 deficient after several years, and if you take it for a long time, you have about a 30% chance of being B12 deficient if you take the metformin. And there are a lot of people who aren't deficient, but they're in that marginal deficiency area, the subclinical deficiency. Well, there are two different processes for absorbing B12 from the food. One is through the intrinsic factor, that's the standard way. And you only can absorb a small amount. You can absorb about 1 to 2 micrograms of B12 every few hours with the intrinsic factor. There's no other micronutrient, as a matter of fact, that we know of that requires an extra factor for absorption. The extrinsic factor is, of course, the vitamin B12. The intrinsic factor is that substance that your stomach makes. However, there's another process for absorbing B12, and that's the diffuse process. The diffuse process, about 1% of the B12 is absorbed throughout the intestine. So if you get enough vitamin B12 in, well, you're going to absorb a substantial amount, even though it's only 1%, but 1% of 1,000 micrograms or 5,000 micrograms, that's enough for your body. Well, the digestive process is very important. So digestion, you have the proteases in the stomach and the small intestine and the acid. That's going to release the B12 from the binding in the food. Then it's going to hook on to another chemical because it would otherwise be destroyed by the acid and some of the other chemicals in the gut. So it binds to this stuff called R protein. Then it gets to the intrinsic factor. It's bound to the intrinsic factor that's made in the gastric parietal cells. Those are the cells that make the acid and other substances. Goes through the duodenum. Has to survive all of the pancreatic enzymes that are secreted. More of it's freed up. Ultimately, it gets to the small intestine, to the terminal portion of the small intestine. We call it the ileum, and that's where the absorption of the B12 occurs, but only the B12 that's attached to the intrinsic factor. The intrinsic factor gets it in, but then it gets separated. So let's take a closer look at the process. So the B12 absorption is going to require an intact stomach function. Stomach has to be working relatively normally, manufacturing the acid. The pancreas has to be working appropriately, making some of the enzymes. You have to have the intrinsic factor, and you have to have the small intestine working normally. Now, if we look at geriatric patients, people who are over age 60, 65, they have a low amount of acid that they secrete. That's just a normal process of the aging process, even forgetting the proton pump inhibitors and the other kind of medicines that we take. Well, seniors have low level of acid, so they're going to excrete in the bowels somewhere between 80 and 100% of all of the vitamin B12 that they consume. So that's not a good situation. Younger individuals, well, only about 30 to 60% of the B12 is going to go out in the bowels. Okay, so now we get to the small intestine, the last part, the ileum. We absorb the vitamin B12. Well, once the absorption occurs, then it's freed from the intrinsic factor, but it's bound to a different chemical called transcobalamin. We call it TC2. So it's a TC2 that floats around in the bloodstream with the B12, and it delivers it to the different cells, principally to the liver. So once it's consumed, once it's in the cell, then we get the active form of vitamin B12. Well, as I mentioned, we can have another method of getting the B12 into the system, and that's simply by flooding the system, taking a sufficient amount a day. Now, every single day, you're going to lose about 0.1% of the B12 in your body through gut secretion. It's going to go out from the liver where it's stored into the bile, and then it's going to go out. Now, fortunately, much of the B12 is going to be recirculated through what we call the enterohepatic circulation. It goes through the liver, goes into the gut, and then comes back again. Well, that's quite helpful. Now, who gets to be vitamin B12 deficient? Well, there are a lot of people who can be vitamin B12 deficient. You can have inadequate intake because you're malnourished, you're not eating properly, you're an alcoholic, you're an elderly individual, or you have a stomach problem. Just because you're growing older, just because you're popping all of those pills. And in fact, the most frequent form of vitamin B12 deficiency is what we call food-bound cobalamin malabsorption. That means the B12 can't get out of the food, it's stuck to the food. And that happens in people who have the atrophic gastritis. Maybe they have infection with that Helicobacter pylori that people have talked about, or maybe because you're taking the proton pump inhibitors, or you're taking the other medicines that decrease the acid production, like Zantac. Maybe you've had your stomach operated on. Maybe you were too heavy and you had a gastric bypass. Maybe your pancreas has a problem. Maybe you have an issue with your small intestine. Maybe you have some bacteria growing in the small bowel, small intestinal bacterial overgrowth, or celiac disease. Or maybe those little villi in the intestine that help with absorption don't seem to be working properly. Or you've had an operation, maybe because you had a stomach ulcer, duodenal ulcer, maybe you had part of your bowel resected. Maybe you had an ileal resection. Maybe you have Crohn's disease or malabsorption. Maybe you're pregnant or you're taking a birth control pill. or we talked about the metformin, but also we can have interference with the intrinsic factor B12 absorption if you happen to take colchicine, or if you're taking a medicine known as cholestyramine, or slow K, or you have infection because you went out camping and now you have Giardia in your intestine, or you have tropical sprue. And certainly the vegetarians are at risk. And so too are the fetuses and the infants born to mothers who are strict vegetarians. Or you've had some sort of invasive surgical procedure in your gut. And subclinical deficiency is another issue that's relatively common. And this is a condition where the B12, as I said, should normally be more than 150 picomoles, but when it's sort of on the borderline, anywhere up to about 250 picomoles, that might not be really sufficient depending on what's happening in your body. And that happens in about somewhere between 2 to 25% of the general population. That's actually more common than a clinical B12 deficiency. And it can progress to B12 deficiency, or it can just stay as marginally deficient. But during periods of stress, during periods of growth in children or adolescence or pregnancy, you seem to need more. So it can throw you from a subclinical deficiency to a clinical deficiency. And how do we make the distinction? Well, we can measure the B12, but we have even better methods to find out if you're B12 deficient. We measure something called MMA. And if we measure methylmalonic acid, that's the MMA, or the homocysteine, if those two are elevated, especially the MMA if it's elevated, then even with a normal B12, we can say you probably don't have enough. Well, how does it present? What kind of symptoms do you have? Most people who are vitamin B12 deficient don't have any symptoms, but some people might have some blood abnormalities. You could have big red blood cells. They could have an increase in what we call the mean corpuscular volume. You could have decreased hemoglobin. The white blood cells that are segmented normally might have extra segments, have 5 or more segments. You could have a decrease in the platelets that are important for clotting. You could have some neurologic deficiency. You could have some peripheral neuropathy or urinary incontinence or erectile dysfunction or bowel problems. Some of the neurologic manifestations of vitamin B12 deficiency might include Alzheimer's disease, depression, mania, delirium, psychoses. But there's no correlation between the blood abnormality and the neurologic abnormality. It seems that many people who are deficient in B12 have either one or the other kind of symptoms. So you might have fatigue and anemia if it's relatively mild. If it's a little bit more severe, maybe you have some fatigue and shortness of breath or palpitations. Maybe you seem a little bit pallid. Maybe you have an obvious anemia. Maybe the cells are extra big. Maybe your tongue is a little bit inflamed. You could have some subtle neurologic changes. Maybe you have some change in the perception of feel on your fingers and toes. As we get more severe vitamin B12 deficiency, then you have bone marrow suppression and you have clear evidence of neurologic abnormalities. You can even have a cardiac problem. The skin becomes hyperpigmented, you can become infertile, and even B12 deficient individuals can develop osteoporosis. So if we look at the neurologic problems, well, at least 20% of the people don't have any anemia. They have the sensory loss, they have abnormal balance and reflexes, they have cognitive impairment or memory loss, or sometimes they have stupor or psychoses like hallucinations or paranoia, severe depression. But that's the end extreme. Most of the people don't have any demonstrable specific syndrome. Sometimes if you have really severe vitamin B12 deficiency, then you can have subacute combined degeneration of the cord, the spinal cord. You have a bilateral peripheral neuropathy. You have clumsiness, and you have poor coordination, difficulty walking. You can't feel the vibration if somebody puts a tuning fork up on your finger or moves your finger or moves your toes. You're not aware of what's happening. People become deficient in their sense of taste and smell. The optic nerve can become atrophic. You can develop a dementia-like illness. And it can happen in the pediatric population too, especially children who were born to mothers who are deficient in vitamin B12 because they're vegans or vegetarians. We can find the problem in exclusively breastfed infants who are 4 to 6 months old, have failure to thrive. There seems to be some feeding difficulties and lethargy, some tremor, hyperirritability. And if it gets really bad, then it can go on to delayed myelination of the nerves and brain atrophy and coma. And they may or may not have anemia. Well, vitamin B12 deficiency is thought to have something to do with the heart, but the American Heart Association says we don't have enough adequate information to say that if you take vitamin B12, you're going to reduce your risk of cardiovascular disease. And the Cochrane collaboration says that even though vitamin B12 is very important for your central nervous system, there's not enough evidence to say, at least at the present time, that you can avoid or treat dementia or cognitive malfunction by taking some vitamin B12. But you should consider B12 deficiency if you happen to have anemia, if your red blood cells are extra big, if your MCV, that's immune corpuscular volume, is over 100 units, if you have any kind of clinical symptoms, if you have a known gastrointestinal disorder that's associated with low level of vitamin B12, if you're popping those PPIs, those proton pump inhibitors, you're taking your Prilosec and your Prevacid every day. Well, those are the individuals that need to be evaluated, need to be tested. So how do we test? Well, one of the simple things we can do is just simple blood test. If a person has a macrocytic anemia, big red blood cells, but not enough of them, then chances are we have a B12 deficiency, and especially if those, what we call segmented neutrophils, if they happen to have extra segments, more than 5 lobes, if you have an anemia and your cells are big and you have more than 5 lobes, chances are you have an issue with your B12. But there's no standard, there's no gold standard for measuring the B12. We have a B12 test, but unfortunately the B12 test is frequently in error. And that's why, as I mentioned before, we need those surrogates. So we have to measure the methylmalonic acid, we have to measure the homocysteine, and especially the methylmalonic acid, because that gives us the best evaluation. Now, even that isn't 100%. Now, some people seem to have a very high level of vitamin B12, and paradoxically, they can have symptoms of B12 deficiency even though they have a high level of B12. And that's because they have qualitative abnormality. They have enough B12, but it isn't doing the right thing. It's not being transported to where it needs to go in the body. And that happens frequently in people who have solid neoplasia cancer, hematologic cancers, leukemia, lymphoma, or have liver or kidney disease, people who have liver metastases or renal failure, alcoholism, or certain autoimmune diseases. Well, fortunately for us, you don't have to worry about every single day about getting enough vitamin B12 because you have a sufficient amount in your body, if you're otherwise normal, to last you somewhere between 5 and 10 years. The traditional pernicious anemia that we saw once upon a time tends not to be very common anymore. It occurs in about maybe 1, 2, or 3% of people over age 65. These people have an autoimmune condition where they make antibodies to the intrinsic factor. The intrinsic factor doesn't work well. And when the intrinsic factor doesn't work well, then of course we can't get enough vitamin B12 in. But that's a relatively uncommon condition. It occurs in average age of 70 or 80 in people of African ancestry or European ancestry. These individuals can also have the gastritis with low levels of acid production. Maybe the Helicobacter pylori has some role in it. There's a triad in pernicious anemia. They have the anemia because they're not making enough DNA, so they can't, the bone marrow doesn't work properly. They have some gastrointestinal symptoms, and they have neurologic symptoms. Well, we can do a blood test and find out if a person has antibodies to the intrinsic factor. That's relatively easy to do. So what about fortified foods? Well, the good news is that fortified foods are the vitamin B12 is free to be absorbed relatively easily. It doesn't require the acid to separate it from the food. It's already in the free form. So that's one good sign. But unfortunately, we still need the intrinsic factor. And you still have a limit on how much vitamin B12 you can absorb. Some people are turning to spirulina and say, hey, that's going to give us a substitute. But actually, it's only an analog of vitamin B12 from spirulina, and that's not active in humans. You could take a supplement. Well, a supplement, over the counter, you can get as much as 5,000 micrograms in a pill or an energy drink or an energy shot or multivitamin pill. Or you can have grain-based foods that are supplemented, the breads and the pasta. Or you could get an injection. And the injection of vitamin B12, in the old days, we used to give 1,000 milligrams, 2,000 milligrams, or micrograms, I'm sorry, 1,000 micrograms to 2,000 micrograms a day for a short period of time, then space it out to 1,000 micrograms a week and then 1,000 micrograms a month. That would be given deep underneath the surface of the skin, preferably into the muscle. Well, there's some cyanide in there, but the cyanide is less than you get in your food. If you take folic acid, that could mask the problems with the nerves. So if you get enough folic acid, your blood looks okay, but now you have the nerve damage from the B12 deficiency that progresses. So as a result, the government suggests that you limit your folic acid consumption to less than 1,000 micrograms a day, so that if you do have a vitamin B12 deficiency, that those nerve problems aren't going to be masked over. Let's say you have a deficiency, you begin your supplement, how long is it going to take to get back to normal? Well, if we talk about the megaloblastic anemia, if you have the anemia, it's going to start to respond within about 5 days, and it should correct within about 4 to 6 weeks, depending on how severe it is, but it could unmask either folic acid deficiency or even an iron deficiency. Neurologic response, relatively slower. You get some response after about a week. Sometimes the paresthesias heal more rapidly, but the sensory and the motor problems that are associated with vitamin B12, they might not go away completely. So anyway, that's the story of vitamin B12. And the more we learn about it, the more we learn about our changes in habits, especially with the pills that we take. More often we're treating ourselves for the gastroesophageal reflux and indigestion. The more it seems that vitamin B12 deficiency is making a comeback. Most of the vitamin B12 deficiency is a subclinical deficiency. So word to the wise should be sufficient. If you're on long-term suppressive therapy for the acid, or if you're taking metformin for a long time, or if you're over age 65, you could be at risk. And for the overwhelming majority of people who are vitamin B12 deficient, the symptoms are absolutely non-specific, maybe fatigue or memory issues or loss of balance. So the good news is that we have readily available tests, blood tests available, and you can go and take a supplement. What about the shots? And the good news is, for the most part, requiring a shot of vitamin B12, well, that's old hat. We can now flood the system with the oral over-the-counter medicines, and that's usually quite sufficient. Anyway, thanks for watching. If you enjoyed the show, please tell a friend to consider subscribing so that you'll be notified when we post new videos. Appreciate your interest. I'm Dr. Ken Landau.